while toiling selflessly during their essential.
सर ये हमारा यहाँ का स्वागत है तो आपके शो में
mind physically interact with people. After the 2 years plus of our problems with the pandemic, we have had tough times. That we are out of this pandemic phase now. Yes, within a short time, but also develop a vaccine. Not only develop a vaccine, even administer it within, let's say HIV. First case of HIV, 1981. Franchise the US scientists calling it human T-cell virus, T-cell leukemia virus. And then I congratulate the SKUAST team for having organized this conference and hoping.
Thank you, sir, for your address.
As a medical researcher, apart from what coronavirus taught the policy planners, politicians and everybody around, it taught us so many things in medical research. It has been a great teacher of sorts. It taught us that you have to go by evidence-based medicine. We know that everything under the sun was tried, as was stated in the morning by people, that micronutrients and other things were tried, and all have come to a naught. We have tried ivermectins, we have tried hydroxychloroquines, we have tried so many drugs, ritonavir, lopinavir, to name just a few, that have been tried and come to naught. Today we say that they are of absolutely no use. So evidence-based medicine is something that coronavirus taught us has to be followed. We have had celebrated heads of states talking about Lysol getting in.
He has written 10,000 articles. He was a columnist. Difficult how many portfolio we can write on that board. Thank you very much to be here to bless us all. When we talk of, I am from agriculture to make the farmers aware how to deal with this corona pandemic.
Of a nature where we are not really sure what the future of the virus or the future of further novel coronaviruses will be. I believe that, as with all challenges faced by not just this city, our country, but humanity as a whole in the present day and age, all answers lie in holistic planning and collaborative responses. We traditionally have been a system which has not based most of our responses to emergencies and challenges.
इंतहाई हो जाए तो खुदाई आती है. So I think this was also God's will to take you back to where you were and you forgot where you had come from. On the futuristic side, Prime Minister had been talking about digital health. That too he spoke from Red Fort. He had been speaking about it for the last 5-6 years, but we didn't realize the relevance of it till COVID struck us. And in a big way, we could provide COVID assistance, COVID management through the means of telemedicine. Even in my own constituency, we ran a telemedicine mobile clinic called Doctor on Wheels, which covered 60 such villages where people had not even seen a doctor. So ये नहीं था मालूम डॉक्टर का चेहरा कैसा होता, 2 नाक होते, 3 कान होते. And there they had the facility of getting the whole body checkup and consultation with the best of the super specialist doctors, because we had tied them up with a hospital at Bengaluru, at a hospital in Hyderabad, and a hospital in Ahmedabad. Though that was done through philanthropy, but this is a huge new opening which the country has got to be aware of, both the medical fraternity as well as those who are the takers of it. And now, I think, what do we learn from it and how do we go about it? As Junaid was referring to the collaborative experience, I think for us, to translate it into the scientific activity, we have to have an integrated approach. And that's what COVID taught us. You had the greatest protagonists of allopathic medicine asking for what possible Ayurvedic drug could help or a Unani drug could help in boosting the resistance. और कई तो वैसे ही खाते चले जा रहे थे, benefit of doubt, कि नहीं भी करेगी चलो खाने में क्या थे. But that brings us to one of the important inferences that in the medical management also, a holistic approach is no longer an option, but is in fact a necessity. And we have to have an integrated, but integration in the true sense. यहाँ कई बार ऐसा भी हुआ कि आयुर्वेदिक का डॉक्टर ने एलोपैथी की दवाई लिख दी अपने नुस्खे में. So that's why I in fact advocated single room consultation with multiple chambers. And we practiced that. We tried that once at AIMS, Delhi, in late 90s. Same room, adjacent chambers. You have the consultant, then you have the dietitian, then you have the yoga expert, then you have Ayurveda. So the same patient, the same card rotates through 4-5 rooms. It was only the sanatorium treatment. And short of that, we didn't have anything, and many of them didn't survive. So in fact, the tuberculosis fatality or mortality became a part of the folklore. If somebody had tuberculosis, he would be deposited by the family in the sanatorium. They would go to meet him occasionally, leave the goods aside. We get to realize it after the event is past. On the very first day when the vaccination drive started in this country, we had vaccinated more number of people than the population of many of the European countries. So that was the kind of the zeal, the enthusiasm, the commitment with which our vaccinating teams went around the country. And if you look back at the social level, I think we needed something to happen to take us back to our oriental roots. And COVID took us back. कम से कम इसने ये तो सिखाया कि खाना खाने के बाद हाथ धोने चाहिए. पहले हम क्या करते थे? रिश्ता गोश्त गुश्ताबा और मट्टू साहब को ऐसे कहा क्या हाल है जुनेद, और उसके कोट पे अपना हाथ साफ कर दिया. About 5 years back, because I have a bad habit of washing hands before meal and after meal, we were in one of the 7-star hotels, and I just wanted to wash hands. They were angry that they had their wits end because they didn't have.
मुबारकबाद देना है प्रोफेसर नज़ीर, वाइस चांसलर और उनकी सारी टीम को. मुझे लगता है कि कोविड पैंडेमिक के आफ्टर माथ में ये पहली बार इस प्रकार की कॉन्फ्रेंस हो रही है, इंटरनेशनल लेवल की कॉन्फ्रेंस, जिसमें कोविड को लेकर के तो विचार विमर्श हुआ ही हुआ, लेकिन मुझे लगता है कि इससे ज़्यादा हमारा 2 दिन में इस बात को लेकर के चिंतन रहना चाहिए और इसको लेकर के कि आने वाले वक्त में हिंदुस्तान जिस तरह से कोविड से कामयाबी के साथ निकल करके आया है और प्रधानमंत्री श्री नरेंद्र मोदी के नेतृत्व में हमारी जो इनहेरेंट कैपेसिटी थी, रेसिलियंसी, उसकी मिसाल सारी दुनिया ने दी है. और आने वाले वक्त में जो वर्ल्ड इकॉनमी है उसमें हमारी एक प्रमुख भूमिका रहने वाली है, हमारा प्रमुख रोल रहने वाला है. उसके लिए हम कैसे तैयार करें, मुझे लगता है उसके लिए सबसे अहम जो मुद्दा है और सबसे अहम हमारा बिंदु है वो है स्टार्टअप पोटेंशियल. जम्मू कश्मीर में और वादी कश्मीर में भी अनएक्सप्लोर्ड पोटेंशियल मौजूद है जिसकी तरफ अभी तक तवज्जो नहीं दी गई. चाहे हमारा एग्रीकल्चर सेक्टर है, चाहे हमारा सैफरॉन है, चाहे हमारा सेब है. और इस 2 दिन की कॉन्फ्रेंस के ज़रिए इस पर विचार किया जाए टू रीच आउट टू द राइट काइंड ऑफ स्टार्टअप हंट. ना सिर्फ वो लोग जो हमारे तक पहुँचे, लेकिन वो लोग जो इसके हकदार हैं, जिनमें वो कैपेसिटी है, एप्टीट्यूड है, पोटेंशियल है, लेकिन उनके पास ज़रिए नहीं है, रिसोर्सेज नहीं है, उनको हम तैयार कर सके. क्योंकि स्टार्टअप के साथ साथ सस्टेनेबल स्टार्टअप, और हिंदुस्तान की इकॉनमी आने वाले वक्त में दुनिया के दूसरे मुल्कों के लिए इसलिए भी एक मिसाल बनेगी कि हमारे यहाँ जो और अनएक्सप्लोर्ड पोटेंशियल जैसे डीप सी मिशन है, जो समुद्र के नीचे का सरमाया है, उसकी तरफ भी अब मोदी जी की सदारत में तवज्जो दी जाने लगी है. और अब मैं ये कह सकता हूँ एक फिक्रे में, द वर्ल्ड इज़ रेडी टू बी लेड बाई इंडिया. नाउ इंडिया हैज़ टू बी रेडी टू लीड द वर्ल्ड. और उसका सबसे बड़ा हमारे लिए सरमाया, हमारी जिम्मेवारी रहेगी हमारे यंग स्टार्टअप्स की, और जो हमारी पीढ़ी के लोग हैं उनके ऊपर जिम्मेवारी है उनकी कैपेसिटी बिल्डिंग की, ताकि जब आज से 25 वर्ष के बाद आज़ाद हिंदुस्तान अपनी 100वीं सालगिरह मनाए तो वो फ़ख्र के क्या साथ कह सके वी आर दी आर्किटेक्ट्स ऑफ सेंचुरी इंडिया, और हम फ़ख्र के साथ आज ये तसल्ली कर सके वी हैव कंट्रीब्यूटेड टू द कैपेसिटी बिल्डिंग ऑफ द फ्यूचर आर्किटेक्ट्स ऑफ इंडिया। नहीं देखिए, इलेक्शन का जहाँ तक ताल्लुक है ये तो इलेक्शन कमीशन ऑफ इंडिया का फैसला होता है, सरकार इसमें कोई मुदाखलत नहीं करती, शायद पिछली सरकारें करती होंगी। लेकिन जहाँ तक हमारी जमात का ताल्लुक है, भारतीय जनता पार्टी का, हम हर वक्त, हम 24/7 पार्टी हैं, हर वक्त हर किस्म की इलेक्शन के लिए तैयार हैं, चाहे वो पंचायत का हो, चाहे वो विधानसभा का हो, चाहे वो लोकसभा का हो।
Subscribe Asian Mail, press bell icon, never miss an update.